There are many conditions that people take prednisone for, and some of them it's absolutely essential, but others, maybe they shouldn't actually take it. Maybe there's something they should take first before defaulting straight to prednisone. And today I have an expert guest to interview to tell you all about chronic urticaria. Welcome to the show, Sarah.
Thanks, Megan. Thanks for having me.
Awesome. And Sarah is an expert on this, and I am Dr. Megan, the prednisone pharmacist. So I'm an expert on a drug that maybe people should, maybe people shouldn't use. And she's an expert on the disease so that we can learn more about what it's really like and what are potential things we could do instead of going straight to what I call the nuclear option. Prednisone is really a nuclear option, and we shouldn't necessarily go straight there. Right, Sarah? What do you think about that?
Yeah, absolutely. Yep, I see that a lot in my community. I see a lot of people going, their doctors prescribing prednisone when that shouldn't necessarily be the first option.
Yeah. So people probably haven't heard of what this is. Can you explain more of what chronic urticaria is, some other names for it, what they might have actually heard of it being called, so that they can kind of understand the framework of what we're talking about?
Yeah, so chronic urticaria is the name for chronic hives. And that's also known as, it could be chronic spontaneous urticaria or chronic idiopathic urticaria are the two most common. There's lots of other forms of chronic hives, but that's where my focus is. And, you know, people think of it as a skin disease because you hear the name hives, but it's actually, it's a mast cell disorder. So, you know, we sometimes get systemic symptoms as well. You know, people experience brain fog, fatigue, joint pain, headaches, GI symptoms, all kinds of things. So it's really misunderstood, and a lot of people with this disease, you know, they feel very isolated and, as I said, misunderstood, and even a lot of doctors aren't very familiar with it. So unfortunately, you know, sometimes we have a little bit of dismissive behavior from the doctors, or, you know, as we talked about, kind of going straight for the nuclear option, you know, versus going through these other steps.
Yeah. So what's interesting about the name of this condition we're talking about, how it's gone from chronic idiopathic urticaria to chronic spontaneous urticaria, or maybe just chronic urticaria in general, is that's the same thing that happened to the name of my disease, the reason I took prednisone. So it's called idiopathic thrombocytopenia purpura. At least that's what they called it when I went to school. Now they call it immune thrombocytopenia purpura. So they just changed, it used to be ITP for idiopathic. Now it's ITP for immune. So They changed the name because they understand a little bit better about where it's coming from. Because idiopathic means we have no idea why this is happening.
Exactly.
It's just happening. So it's interesting to hear that the 3-letter acronym for my disease changed. It used to be a 3-letter acronym I learned, CIU, but apparently it's not anymore. CSU? Is that what you would call it?
Yeah, exactly. Yeah. And unfortunately, you know, a lot of doctors don't even know the update. So they're still diagnosing people with CIU, and they think that CSU is a different disease. So it's a little bit confusing, you know, when you go to look for the information, because the different names. So it can cause a lot of confusion. Yeah.
Exactly. I mean, I even asked you, I'm like, so what are we talking about?
Yeah.
We're talking about this one or that one. And oh, they're actually kind of the same thing.
Yeah.
So I'm glad for that clarity, so we can all understand exactly what we're talking about now. And so it's this chronic condition, chronic meaning it's more than what?
The guideline is 6 weeks. So if you have hives consistently over a 6-week period, then it's then considered chronic once you pass that 6-week mark.
Okay. And then before that, it's acute, right? ACUTE, acute urticaria. And often, I'm just going to interject the pharmacist side right now. Often if it's acute urticaria, it can be drug induced. And so a drug-induced urticaria is usually caused by antibiotics, could be an NSAID like ibuprofen. It could be other antibiotics. So penicillin is the most common, could be things like sulfa drugs. I personally had that when I was a baby. So like when we're talking about this, I have had my fair share of drug reactions. So penicillin and then sulfa and then opioids. So pain medications can cause this type of a reaction. I had that after my baby was born. I was like, man, these hospital sheets are sure itchy. Oh, they're so awful. And then my throat started closing off a little bit. I'm like, man, it's hard to breathe in here. And it turned out I was allergic to the pain meds they were giving me after my baby. So I've had, these weird drug reactions, but that's not what we're really talking about today, right? We're talking about chronic, we don't really know the source. Is that right?
Right. Yeah, it can be a lot of different, the root cause, is like kind of unknown still and it can be a lot of different things. And actually, some people do their chronic hives kick off from a drug reaction. So say NSAIDs, for example, like that's a really common one that I actually recommend that anyone with chronic spontaneous urticaria not take NSAID medications because of the higher risk of reactions and even anaphylaxis.
Yeah. And I was even reading that oral contraceptive pills, like birth control pills, can cause this. Have you heard
Yeah,
of
there's a lot of medications. Unfortunately, there's an enzyme in our gut called DAO, and that helps break down histamines in our food. And then these drugs can impact that, so we're not making as much. And then that can, it can contribute to, your symptoms. So.
Okay. Wow. So there's so many factors to consider. What are other factors you consider that aren't drugs when you're talking to people?
Yeah. So, the big, like the two subtypes of chronic spontaneous urticaria would be either autoimmune or autoallergy. But other than that, you've also got other things going on, what caused those. So a lot of times that is going to be looking at the gut, and seeing how your gut health is. A lot of people have other GI symptoms, as we mentioned, and that can be from the histamines. It's kind of like the chicken or the egg, but a lot of people have those gut issues, and sometimes it can be an infection too, an underlying infection. So if you have an undiagnosed infection, say SIBO is a really common one, and H. pylori, those are both infections that you can have in your gut, or parasites. A lot of people have like an infected root canal. And once they address those issues, a lot of people will see their hives go away.
Wow.
Yeah, so that's like the one that we know is treatable, curable. If you have an infection, if you're able to identify and treat that, then you can be symptom free. But then you've got the autoimmune and autoallergy. So those are kind of, you can put those in remission, but it's going to be a long-term, it's not a cure.
Yeah.
So,
It takes a long time. Yeah. Autoimmune is so tricky.
yeah.
So that's what my condition is. So I definitely understand the whole autoimmune situation. So you mentioned mast cells, we mentioned histamine, and basically, if you don't know what those are, they're basically your immune system going haywire. And so it's not doing the right thing. Normally, if you were having some sort of allergy or reaction to anything in your life, it would probably be because, your immune system would immediately react in a consistent way that wouldn't hurt you. And when we're having this situation, it's where your immune system's like out of control and your reaction is inappropriate. So in this situation, the reaction is inappropriate when it comes to the histamine and the swelling, right? Can you explain about the swelling and what it looks like in chronic urticaria? Like, what does it feel like?
Yeah, so, not everyone with chronic urticaria has the angioedema, which is that swelling, but a lot of them do. And that's actually, they call it like deep hives. It's more in the deeper layers versus the, top layers of your skin where your symptoms are presenting. So, and unfortunately, it's not consistent. It can be, you can come up with a swollen eye, you can come up with a half swollen lip. It really impacts your self-esteem though, and it's really hard, when you have to go around looking like that. And feeling self-conscious like that. So it really impacts people's lives. But so our mast cells release a lot more than histamine. There's so many different other mediators that are released. One of those, I believe, is heparin. So you get kind of that leaky, more swelling and things like that.
So there's a lot of factors to consider, it sounds like.
Yeah.
Things going on. And so it's hard to find the root cause. It's hard to find the appropriate treatment. So what do you recommend somebody does when their doctor first diagnoses them?
Yeah, so you're going to want to make sure when you initially go to your doctor that you bring evidence first of your symptoms, because a lot of us too, you don't have hives consistently all day long. Sometimes they're a lot worse like at night. So then you go to your doctor and you don't have any hives and they're kind of like brush you off. Yeah, so definitely take pictures if you have pictures. If you notice any patterns, let them know. If there was a triggering event, like if you had a illness of sorts, or if it was maybe a drug reaction, make sure that you let them know about that. And then do you want me to go over like the guidelines for treatment that are general?
Yeah, I think that would be helpful because people, it sounds like you said, the doctors don't quite understand. And while I believe in medicine, while I believe the doctors are well trained, there are conditions that people take prednisone for that aren't something that doctors see every day. And so they might just go for the big guns, not even realizing that there are options to consider. So tell us, what are these potential non-prednisone treatments people could use?
Yeah. So according to the guidelines, generally they'll start you on just your typical over-the-counter. It's called a H1 antihistamine, and that would be like Allegra, Zylol, Zyrtec, things like that. They like to avoid the drowsy medications like Benadryl. Those have a lot of side effects, and they're not as effective as these newer medications. So if that doesn't work, then it's usually like a 2-week period they'll give you. If that doesn't work after 2 weeks, they can increase that medication up to 4 times the standard dose. And, of course, you don't want to do that on your own. You want to do that under doctor guidance. But yeah, so you can take up to 4 times the standard dose of these antihistamines. And then sometimes they'll add what's called the H2 antihistamine. And that is like Pepcid is a common one. And that helps with the histamines in your gut that we talked about earlier. So sometimes a combination of the H1 and H2 antihistamines, those are enough. Sometimes just the H1 antihistamine is enough to get your symptoms under control. But sometimes we've got those H1 antihistamines 4 times the dose plus our H2 antihistamines, and you're still not seeing relief. So then they're going to start looking at injectable biologic like Xolair. And that can take up to 6 months to work as well. So, some people's hives are just really stubborn, so unfortunately, there's not just one treatment. It's this process that you kind of go through to discover what works for you. And if Xolair doesn't work, then they move on to immunosuppressants like cyclosporin. And again, like we want to go through this process because, as we gradually go on, we're getting more and more side effects from these medications, probably a bit more expensive as well. So then if the cyclosporin doesn't work, that's when they're going to start looking at adding a steroid like prednisone more long term. And a lot of us get like a prednisone pack for short term just as needed. So if you're having a really bad flare, you've got something there to take, and your doctor will give you instructions on how to take that. But yeah, we really want to look at prednisone as more of a last resort for a long-term everyday use. But it's certainly helpful in a really severe flare just to get your symptoms under control, put that fire out.
Yeah, because it's not just, oh, you're itchy, right? Like there's so much more to it. But before I get back to that, I wanted to talk about the Xolair because before I went full-time as the full prednisone pharmacist, I used to spend my time doing insurance appeals. And so I would often get requests for Xolair, which is Xolair. And it's a very expensive injectable biologic medication. And people would ask for it for this condition. And I would have to decline it often because the records were incomplete. And so my recommendation is, if you are going through this whole rigmarole of trying this drug and that drug and that drug, keep excellent records. Like, okay, this is the day I am starting the 4 times higher dose. And I took it every single day for however long, because the insurance companies I would do these requests for would be like, oh, they only did it for 10 days, not 2 weeks. So we can't approve it. And it's like, oh man, like they were so close. I want to give it to them and I can't, because there are guidelines. Like they don't want to have to pay for the Xolair
Right.
unless you have filled every single box. So that's my recommendation, is keep very good records of exactly what drugs you took, when you took them, and how high of a dose.
Yeah, that's great advice. Because yeah, often that's an issue that we see, like in my support group. You know, people can't afford this drug and their insurance is denying it. So
And that's why.
yeah.
Then if their insurance denies it, tell them to appeal, because appeal pharmacists have more, and doctors have more leeway. We can do more things than just the black or white. Like there's more ability to use clinical judgment. So yeah. So shoot, what was the question I was asking right before this? When I was like, oh, it's not just it's itchy, right? There's more to how it's affecting a person's life. Can you tell us more about how it affects your life?
Oh yeah, absolutely. And you know, as I said before, a lot of people have systemic symptoms. But even just, you know, some people do have only the skin symptoms primarily, but even just that is so impactful on your life, because, you know, not only are the hives visible, the angioedema visible, and it impacts your self-esteem, you know, because people don't understand, you know, people make comments, people, well-meaning people sometimes, you know, they'll give unsolicited advice, or they'll say, oh, I got hives before. And it's just a totally different game when you have hives every single day for weeks, months, years on end. It really impacts your mental health, especially, I think. You know, you can't sleep at night because you're up itching. And that, of course, bleeds into everything else. You know, like you're exhausted, you're irritable, you can't think straight, you know. So yeah, it really impacts your mental well-being.
Thank you for mentioning the sleep, because I think that's one part of it that people forget. It is a factor. Like I have a family member who has atopic dermatitis, eczema. She's up all night itching because she has severe eczema, and it, you know, it keeps her up late. And so it's like harder to be a nice mom. It's hard to, you know, like it's not just, oh, you have itching. Like it's your relationships are affected. Your sleep is affected, the rest of your health, because you're not sleeping, right? Like it's not just the one thing.
Yeah, exactly. And that's a great point. It bleeds into everything, and even the way that you take care of yourself. You know, like I don't have energy to be cooking a full meal when I've had an outbreak of hives all night and I didn't sleep. You know, so I'm going to reach for the fast, you know, junk food option, you know, things like that. And then, as you said, like that guilt, that feeling of I'm not a good enough mother now. You know, I'm not a good enough wife. I'm not a good friend, or, you know, because I don't want to go out and socialize, or, you know, you're just too tired. So yeah, it definitely impacts your relationships. It impacts all kinds of areas in your life.
Yeah. Okay. So we've talked about medications. Are there any other things people can do that might help?
Yeah, so some other things that sometimes help, well, a lot of times our vitamin D level is low. And your vitamin D has a lot to do with your immune system. So get your vitamin D level checked for sure. And, you know, supplement with that if appropriate, you know, of course, with your doctor's guidance. But a lot of people do see a reduction in symptoms with supplementation of vitamin D. And changing up your diet a little bit helps a lot of people too. So there's actually two different diets that they have done a lot of studies. One is called the Low Histamine Diet, and that has a pretty good efficacy for reducing symptoms. And then the other one is a pseudo-allergen-free diet, and that eliminates, I feel like, a lot more pleasure foods. So I prefer the low histamine option, because with pseudo allergens, it's like all your spices and herbs and your aromatic foods. So, but yeah, so diet, stress relief. Stress definitely has an impact. And unfortunately, again, it's that, the hives cause you extra stress in your life, but also stress causes hives. And it's kind of, you get into this cycle. But learning some good stress management techniques, learn a breathing technique, master it. And then when you're in a stressful situation, you've got that in your pocket, because stress definitely can cause a flare up. And, oftentimes, you hear stress hives, people will, your family members or even your doctor might say, well, they're just stress hives, So yeah, they're associated. That's not the cause. Don't let people tell you that, but definitely getting that stress under control. We can't necessarily control, like, you can have a stress-free life, but you can certainly learn to become more resilient and kind of manage that stress and your physiological response to the stress. So either breathing technique, maybe a meditation, emotional freedom technique, whatever suits your style. Just look for a stress management technique and master it. Yeah, I think that's really it. So your nutrition, looking at dietary factors that might be impacting, and your stress. Awesome. And another thing would be actually like environmental toxins, things that we're putting on our skin in particular, avoiding things like fragrances, because there's a lot of different chemicals in those that, again, they're not really regulated. They can affect your immune system. So we want to cut those out.
It sounds like there are a lot of things you could do.
Yeah.
And it sounds like it's a little complicated, but you've already figured it out. So how can people find out how to work with you more closely to, skip ahead and not have to figure this all out themselves?
Yeah, so you can find me at my website, thrivewithhives.com. Or I also have a Facebook support group. It's called Women with Chronic Urticaria, Thrive with Hives. And, there's a lot of information in there and on my website that you can find. I mean, you can also contact me.
Awesome. Because it seems like you've done so much research to understand what's causing it and what is in people's actual control to change within their own lives. And so it seems like it would make a lot of sense to just work with you so that they don't have to spend all that time that you've already spent. By the way, how long have you had urticaria and been researching and studying this?
Yeah, so I've actually had chronic inducible urticaria, which is a whole different thing since I was a child, but chronic spontaneous urticaria, which was also idiopathic when I was first diagnosed, I've had for over a decade. So lots of experience there. 10 years ago, we didn't have as much information as we do now. There's a lot more support and resources out there. So you're definitely not alone. You'll never feel like, you're alone or you're isolated. There's community that you can find, there's resources for you, and we're here to help. So
wonderful. Thank you so much, Sarah, for joining me so that we can help people who are taking prednisone for this condition, but don't know whether it's the best option. So basically our takeaway is, if you have been prescribed prednisone for chronic urticaria and it's the first thing you've been prescribed, maybe you should ask if you could try something else first. But that's really between you and your doctor. If you have tried everything and there's nothing is working, maybe that's when prednisone makes sense. Would you say that's our big takeaway, Sarah?
Yep, exactly.
Okay. Well, thank you so much, Sarah. And we will come back next week with a new episode of Prednisone Warriors with Dr. Megan.